living in an artificially induced state of consciousness that resembles sleep. The poor and the underclass are growing. Racial justice and human rights are non-existent. We have been lulled into a trance. They have made us indifferent to ourselves, to others. We are focused only on our own gain. That is their primary method of survival. Keep us asleep, keep us selfish, keep us sedated.
You're listening to Toward Anarchy on the Republic Broadcasting Network. Here's your host, Michael Storm.
All right, here we go. Thank you so much for joining me. Welcome to the show. I am Michael Storm. This is Toward Anarchy. Thank you so much for joining me. It's Sunday afternoon. It's 1 p.m. Central Time, and that means it's time to do this thing. It's time to come together. It's time to talk about anarchy. It's time to realize that anarchy is the state of the world, that it is the reality that exists all around us, that everything we do, the myriad of interactions that we have with other people, all the things that we do throughout the day, the people that we love, the things that we create, the things that we destroy, we do those things without consideration of or need for the opinion of authority, and it's fantastic. And I just wish that everybody would realize it and apply it to just everything across the board. So that's what we'll be here to talk about. I have a huge show planned out today. I'm overexcited, so hopefully I don't get a little blah, 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 and a little bit too chatty. Try to keep myself in order. It's just been a banner week for myself. It's just everything is coming together with the show. It's just a wonderful thing to be experiencing. And then, of course, I'm doing things in so-called real life, I guess, if you will, not here just in digital voice land. And a little bit of video later today. And that's got me a little bit on edge. Maybe I'll talk about that a little bit this afternoon. But I have so much on the agenda that I do not want to stray at all. We have to start off with the basics and stick with the basics so that we can get them to stick with everybody. And that's to like, share, follow, subscribe, whatever platform you're listening on. Make sure to click those shares and those likes and those follows and subscribes. Go to towardanarchy.com, and I've made it real easy for you there. Any of the pages that are shareable, like the front page itself, somewhere right on that page or on the show page for today, it's the 29th. If you're looking in the archive to find it, you'll see right there at the top, share buttons. There's a Facebook button, a Twitter button, and email button, and then there's another share button that pulls up like 30, 40 different places that you can share your things, depending on where you're at, if you're on Dig or Diaspora or any of these other places. It's not all of them. I noticed that some of these guys that trying to make themselves a name aren't included on this. They're not in here, but they're on the Facebook page at towardanarchy.com if you're looking for them. It's the MeWe connection and the Minds connection and the ThinkSpot connection. And I even added a button. If you notice, actually, if you're at towardanarchy.com, I haven't talked about this. It's kind of funny because it's been this way. Well, the website has been recently updated over the last 2 weeks, and it's completely changed. It has nice big buttons now instead of words, and so it's a little bit easier to navigate if you're using your phone. But I changed it all around and tightened it up quite a bit and added some more things like the link to Instagram. And then there's links all the way down on the right-hand side for a bunch of the different ways that you're able to listen to the show, Stitcher and YouTube and TuneIn and Spreaker and iHeartRadio. There's a bunch of them there. There's a bunch of different, and those aren't even all of them. I was looking around at some of these other various apps and things that you can find in the iTunes store and in the Play Store. And there's Podcast Addict, there's Himalaya, there's Overcast, there's Castro, there's Pocket Cast, there's Breaker. We're on all of those. We're there. You can find Toward Anarchy. So it's real easy to just take that couple extra seconds to make sure you share, you like, you follow, subscribe, whatever platform you're on. Go to towardanarchy.com. Right there on the front page, you'll see my guest today will be Rachel Nielsen. She'll join us in about 25 minutes. She's back on the show. She was on the show before. It's been one of the most popular episodes that we've had across the board, both in video, in terms of video views, which we don't have a lot of because YouTube's kind of an afterthought. My apologies to my YouTube people. I apologize if you listen and some of those shows there sound like they've been hacked up with an axe. It's because I've used the YouTube tools to eliminate the music beds that you hear, get them out of the conversation entirely, because it's just a little clip of somebody's song, and YouTube's algorithms, their software that they have searching things, will just pluck that stuff out of there, and they'll make it so you can't monetize it, or that it won't show in certain places, or it won't show in any place around where it won't even show. So if you haven't been to the YouTube page, I've been working on it recently and cleaning up the problems with the ones that won't show. And so there may be all sorts of videos that you haven't seen up there. The Rachel Nielsen video from the last time we talked is up there, and that goes back to early in the COVID thing. I had her on the show because she's a nurse, and she's working on the front lines of this, and I wanted to get her perspective of it. And her perspective, well, it looks like exactly what we're doing now. I mean, we even talked about hydroxychloroquine. We talked about that at one point, and I just saw another. In fact, I have to step over here for just a second. Let me grab this. It's I did this. Been doing this a couple of weeks now, actually, and I was looking for. I'm just looking at headlines. They just pop up. And I don't want to take them and write them all down. I would mess with all that. So what I'll do is I'll just take a quick screenshot of it on my phone. And I have a bunch of these saved up. And a lot of them are about COVID. And one of them was about the hydroxychloroquine thing, about them realizing that there's a larger percentage of people that are recovering using that particular drug, when there's been some argument about it all along. But I won't dive too much into the vaccine stuff and the COVID stuff now, anti-masks, things like that. We will jump into it in a few minutes when Rachel Nielsen joins us, for sure. So just to do these, because I wanted to do these real quick. Let's see. Military role in vaccine will be strictly behind the scenes, despite Trump's claim. Indian digital pay arena gets more convoluted with opaque 30% cap on transactions. That's something we'll have to talk about. I told you it's coming. People have been telling you it's coming for a long, long time. I'm not the only one. That's digital currency and digital accounts controlled by the government, and you see it's failing in there. They're putting a 30% cap on transactions. Just imagine when your entire economy is controlled digitally for you. It's one thing for you to be able to jump onto the internet, just pull up your computer or your phone and log into your account and shuffle your money around and pay bills and do things like that. It's another thing to have that account centrally controlled by the Federal Reserve or the government, most likely the Federal Reserve, because I was seeing this notion this week. Somebody was talking about it. I didn't even catch who it was, but it was the idea that the Federal Reserve, since they answer to Congress, and that there's no, the only thing that could remove them would be an act of Congress. That Congress would have to agree to end the Fed. That's the only way it'll ever be ended. But that they don't actually control the distribution of money. So like right now they're talking about the stimulus checks, right? Supposedly we're supposed to get a stimulus check again, and this is the sort of thing that they were talking about in this little article that I was reading, and that was this idea that the Federal Reserve, once Congress or once the government forces the digital accounts on us, and we have those digital accounts and all the money is gone digital, the Federal Reserve will control it, and they don't have to wait around. They can just pump money into our accounts at any time, and that was the thought behind that. And so then government won't even be in control of that aspect of it anymore. It's you might look it up. Let's see if I can find the headline. I don't know if it's one that I kept or not. I can tell you about where I found it exactly, but let me finish reading the headline. Study finds 84% fewer hospitalizations for parents treated with controversial drug hydroxychloroquine. And we will talk to Rachel about that. We'll see what her thoughts on that, because she was a proponent of it. She defended it on the show here as a potential. It was early on, so nobody knew for sure, but it was, we had a pretty good idea. Pennsylvania judge halts election certification. That thing keeps going back and forth. Again today, there was another article talking about the fact that the election certification has been halted, has been certified, but that because this one judge says that there's something wrong with it, that the certification may not stand, and it's back and forth. And then there was another one certified today, another state certified today, Oregon maybe. It's just a mess. The whole thing is funny. And Trump phoned into the Pennsylvania GOP meeting to claim that he won the election by a lot. A lot. He won it by a lot. AstraZeneca may conduct additional trial for COVID-19 vaccine after acknowledging error. That was the big news this week, is that all of a sudden we're 3 weeks out from these vaccines being distributed. They're mobilizing UPS, the brown trucks. They've found refrigerated storage systems, installed refrigerated storage systems into their trucks to be able to help deliver the vaccine. And there's all these stories going around, and then all of a sudden it's a bust. There's errors, there's problems, and they're having to step back. Let's see, total COVID-19 cases in the U.S. may be 8 times higher than reported, scientists estimate, which is just fear-mongering. More fear-mongering. Their teeth fell out. Was it another COVID-19 coincidence? A consequence? Who knows? I didn't read the article, so anyone who doesn't, just more fear about COVID-19. This is the point of me giving you these headlines like this. St. Louis doctor simulates what COVID-19 patients see at the end of their life in Twitter video. It's frightening. It's fear. Moderna's groundbreaking coronavirus vaccine was designed in just 2 days. 7 years. 7 years. And no vaccine for any other virus in this family, regardless of what you think of germ theory. Moderna's chief medical officer says the vaccine trial results only show that they prevent people from getting sick, not necessarily recipients still be able to transmit the virus. Duh. I've been telling you that people shed vaccines. People who've had vaccines shed virus when they get it, if they have a real live one, and can potentially give it to people. This is known. People want to argue about this, whether it happens or not. And then, of course, you convolute the argument with questions about the gene theory or germ theory. So that's terrible. An anonymous group of top U.S. CEOs said they would hold off acting against Trump until after the Electoral College makes their decision. MyPillow CEO and Hollywood actor helped get Kyle Rittenhouse out of jail. That was the article that I was actually trying to capture on that one. And that Hollywood actor was Rick Schroeder. And he came out and said he was acting as a father would, getting what he saw was an innocent man who was defending himself and who was protecting private property as being railroaded, and that he believes that he will be found innocent. And that's why he put up a lot of money. It was a $2 million bond, I do believe. And, it's great to see people come to the help of Kyle. I have seen all the videos everybody else has seen, and I believe that he was completely justified in shooting the people that he shot. And he, frankly, very easily could have shot a whole bunch more if he really wanted to. I thought he was considering the situation, and I said it before, I thought he was in pretty good control of his firearm and what he was doing. Let's see, why tomorrow's money will come in new crypto flavors. That might have been, that was a Bloomberg article there from the 21st. We're just talking about all the different crypto coins and digital collectibles is what they are. I've been saying that. We'll have to get into that here in a minute. World Health Organization warns vaccine won't help countries fend off the current wave of infections. Duh. It's just that's really a duh moment. if it helps anything at all. So I just had to do that. I'd been saving those up, and I wanted to go over them because it was just, it's vaccine, it's COVID, it's masks, it's over and over again, it's fear, it's all of this that we've been saying that it is, and we're still talking about a disease, a virus, a germ, or whatever that people recover from, that 99% of people recover from with no noticeable lasting injury or damage to their system over it. It's a weird thing, but it's not when you take it into consideration of the control mechanisms and the idea that people would use this as an opportunity to manipulate people and to take control. And I think that what we're seeing is they're telling you, they'll force you to take the vaccine, and you won't be able to get a job, you won't be able to go to school, you won't be able to go to the movie theater, you won't be able to go to a concert. It's just, this is where we're headed, and they're not, and they're basically telling you that the masks will still be there, that you're still going to have to distance from each other. This is the new normal. They said it months and months ago, and I agreed, and I said that they won't turn it back, and they're not turning it back. They're cranking it up, ratcheting up effect. I brought a ratchet in here, and I said, tick, 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 tick. I spun it around. This is the sound. This is what I hear going on right now. The ratcheting up of the fear and the control. Go to towardanarchy.com. You'll see Rachel Nielsen is going to join me in just about 15 minutes. She's already there waiting in the wings, as it were. If we did this thing live in the sense that she was here in studio with me, she'd be sitting in the green room right now waiting to join me. But as it is, she's comfortably sitting in her own house waiting for me to call her, and we will connect with her in just about 15 minutes, and we'll jump into this conversation about COVID. We'll talk about 2020 rage and just all the anger and everything that has seeped through now. And the excuse, of course, is 2020. Well, it's just so bad we can all act like a bunch of jackholes. We'll get her perspective as an anarchist and as a healthcare professional. Of course, I shared some links with you. If you're so inclined, you can help me fund the website and spread the word about the show at the same time. A lot of different options in ways to do that. It's actually been up there for weeks. I just changed the website, the look of it. Most of it is changed across. If you go into some of the older archive, you might still see some older pages. But for the most part, the website is tighter and sharper. And one of the things that I added now was this shop and support button up kind of near the top of the page, of any page that you go to on the site. And there, I've tried to provide just a couple of different ways to make it real easy, win-win type situations to help support the show. And that's, I have a T-shirt line through Teespring. There's some socks and fanny packs and pants, and I could do masks. There's all kinds of things that I could add to it, but there's a nice selection of them there that you can check out. And I've tried to lower the prices down as low as I can. I couldn't believe going through and setting up the account and looking at it, how much people were charging for just a simple T-shirt. It was $20, and it was just the cheapest, lowest thing. And so I cut my profit off the top of that and knocked that same shirt down to $15. So, yeah, that's what I did across the board on all of them. A $50 hoodie, I tried to knock it down closer to $30. So that's the kind of thing that we're talking about. As far as I'm just trying to find a way to bring a little bit of money in to pay for the website and things like that. There's also a link there to my iRescue Toys account on eBay, and if you click on that, it'll just take you to what I have on sale right now. You see, I have some stormtroopers and some Legos, and I'm always putting some things up. In fact, I'll put a bunch of more stuff up tonight just for some of you guys. I'll put some silver up there. I know you guys like that. We got to go into a break. Come back here, and we will prepare for Rachel Nielsen to join us right here on Toward Anarchy. Just a couple minutes, we'll bring Rachel Nielsen into the conversation. We'll talk to her. You know, she's a nurse. She's worked on the front lines battling COVID-19. She participates. She's an activist. She's an anarchist. She participates in the social media. She's watched the rage grow both on the social media and out on the streets, and she's watched the silencing of reasoned voices, people calling for voluntary action, people calling for informed consent when it comes to things like the vaccines. These voices are being silenced. We'll talk to her a little bit about that. We'll talk to her a little bit about everything. She has a lot to say, and she's been just a great conversation to have. Just the idea of being able to sit down with someone and talk to them, someone who's worked on the inside of this thing and seen a little bit of it. You know, it's one thing to view it all from the outside. It's another to try to get that little bit of that inside information, that inside look at it. And so that's what we'll do here in just about 5 minutes or so when she joins us. In the meantime, go to towardanarchy.com. You're looking for November 29th. That's the day. And as I was saying before I went to the break, we get the T-shirts and stuff up there. If you can, if you got a couple extra bucks, you want a T-shirt, throw it at the T-shirt and help support this show. I have to, real quick, before I go any further into things, before we bring Rachel into the show and do all that, we'll talk about some agorism and things like that at the backside of the show after Rachel leaves us. Because I want to make amends with the agorists. I have an apology to make, but it has nothing to do with them. I have a correction and an apology. So the correction is that there is no anti-mask law in Kansas. I've been saying as an emotional response. It's unfortunate because I don't do this, so don't get used to this. This won't be happening very often at all. I've said 750,000 words since the new show started, and I'm going to apologize for like 3 of them. So this is, that's the percentage chance that this is going to happen again. It's low. I don't usually let things like this go. I don't just make a statement without going out and trying to check some validity in it, and I didn't do it. For some reason, I had it in my mind. What it is. We're all very aware of the culture that has existed over the last 10 years or so, unless you've been sleeping under a rock, and that is, people who protest, and it's been going on even a little bit longer than that. The people who protest, people who want to redress their government. It's a silly notion, but the people who want to do it, they've been caged off, they've been locked up, they've been told they can't wear masks, they've been told that they have to follow certain rules to express their freedom of speech, and it just all coincides with that reality. And at some point I got it in my head. It makes sense. If I were an authoritarian, if it were my rules and I were trying to keep people from being, I don't know, whatever. It's a weird thing, but the whole mask thing just blows my mind. All of a sudden, it was a thing where we don't want you wearing masks. There's been a law on the books in New York that you can't wear a mask since the 1800s. It's just a thing, and there are mask laws, anti-mask, anti-disguise laws in places in the South that have to do with of course the KKK and the hoods and things like that. So it's not like it doesn't exist, but somehow I got it into my head that it was here, and I had made the argument that if somebody were to tell me that I had to wear a mask, I would just simply suggest that I'm carrying a gun and that I can't wear a mask and carry a gun. It's not smart to do, for one thing. Because I'm not a mask wearer, every time I see somebody come around a corner with a mask on, I think I'm about to get jacked. I think somebody's about to rob me or rob the store that I'm in. And so I guess the rest of them are just completely blind sheep, and they don't even see it. They just walking around in their daze with their like the zombies do. maybe that's the problem. They're not seeing it that way. But I suppose if I were an authoritarian, if I were in control, I would have an anti-mask law. I would say you can't wear a mask and carry a gun. The two things seem. But I'm not authoritarian, and I don't care. Wear a mask, carry a gun. Now, all these things, it's fine. Just be prepared to accept the consequences of you making mistakes, doing things, criminal things with your mask on. It's just, the mask thing, it just gets me. So I had to make a correction about that. There is no Kansas law that says that you can't wear a mask and carry a gun at the same time. So unfortunately, it invalidated my argument in that sense. But now I've decided I'm going to go the other direction entirely, and it had immediate impact. I'm dressed completely in black. I'm covered from head to toe, and you cannot see anything but my eyes and my gun. That's it. That's all you get now. So that's the way I'm going to walk around from now. We'll see if that gets some attention. I apologize. I can't believe that I did that, but you know what it is? It's that emotional response, and we're all in that hyper emotional place right now. How can we not be? It takes that extra effort to keep yourself in check, to keep yourself from making some of those simple little silly little mistakes and letting your emotions dictate your actions and your words. And I apologize. I will not let that happen again. Not like that. I don't make the same mistake twice. Not like that. Okay, Rachel Nielsen joins us here in just a couple of minutes. We'll be right back on Toward Anarchy.
You are tuned in to the Republic Broadcasting Network. Visit our website by going to republicbroadcasting.org.
Okay, I am super excited. I've been waiting to bring this conversation to you for a while. Since the first day I had her on the show, I knew we would have her back. So Rachel Nielsen is back with us, and we're going to talk about COVID-19. We'll talk about masks. We'll talk about social media. We'll talk about 2020 rage, anything else that we can get into in the time that we have her here. Rachel, it's great to talk to you again. Thanks for joining me. I appreciate you.
Hey, it's great to be back. I feel like more should have happened since April, the last time we talked, but we really don't have a whole lot more answers than when we started, huh?
That's right. No, and I thought that was a great reason to bring you back here, because we talked about this a long time ago, and what we talked about is exactly still what's happening right now. So it's great to know that we realized what was coming, but it's also kind of terrible at the same time to realize that we're here and this is what was coming.
Yeah, it sure is. It's funny because the issues that we were talking about in April, we were looking forward to where'd the virus come from? How do you treat the virus? All these things. Is the virus really as serious as they say it is? And we've made no headway on any one of those things.
No, every time we see something, there's another excuse or another deflection. We're talking about where it came from. Well, there was just something that came out this week that said, well, no, it didn't originate in Wuhan. They found cases earlier back in September of 2019 in Italy or someplace like that. And so it's just constant deflection, constant guesswork. And in the end, everything that they keep telling us, they're going to force vaccines on us, that we're not going to be able to go to work. We're not going to be able to go to school. We won't be able to enter public places. We won't be able to go to concerts. Ticketmaster came out a couple of weeks ago and made an announcement that that they're working on trying to find a way that won't violate HICFA rules, that they can insist that people be vaccinated before they show up to one of their shows.
Yeah, they're really looking for these COVID passports, aren't they?
Yeah, and they're getting them in some places. Where did I see it? England has one now.
Do they?
Yeah.
I saw that they were going to do that for flights as well.
Yeah, it's kind of a scary thought. It's interesting in that people have been talking about us ending up in this place for so long, about not being able to travel without papers, without permission, whether it's on planes or whether it's just going across state lines. And now boy, the controllers, the Illuminati, whoever all these people are that are involved in this, they really have the tool now at their hand, and it's so much better than terrorism. Terrorism was something you couldn't see coming. Well, this you can't even see. You don't even know if it exists. There are people out there that don't even believe it's a real thing.
Yeah, absolutely. It's really hard to figure out what's going on right now. All we really know is that everything that they're telling us is inconsistent, and we've got to be resilient and take care of ourselves.
That's a good
really
way to look.
I think that's the biggest message that we take away from this whole mess when we can't get good information, is just that we have to be more autonomous beings. We've got to take care of ourselves.
Yeah, no, I agree. That's absolutely right. It's scary because there's so few of us, it seems like, that really want to be individuals and don't want. I'm not a mask wearer. I've been out on the streets, and people are wearing them, and there was this point here not too long ago, before the last couple of weeks, where they started ramping up again, and they started talking about more restrictions and more lockdowns. It's happening tomorrow. There's a whole new set of restrictions and lockdowns going across places in the nation. LA, they're shutting down football games. We're talking about LA. They have like 5 teams in LA, and none of them can play now, or out on the West Coast, and now none of them can play all of a sudden. And it's just all these weird things, and nobody seems I guess there's a couple guys. There was a guy, senator or something in Colorado, that came out and released a big letter and said, ignore all this vaccine stuff, ignore all this mask mandate stuff. We're free. We have the right to do what we want to do, and government can't tell us what, all this stuff. So there's a few people out there that seem to be making some effort, but it bothers me that there's not any greater effort by individuals to just say, this is just silly. This isn't helping. I mean, how they enacted the mask mandates in places months ago, and all that's happened is that COVID numbers have gone up. So the masks must not be working, is it?
Well, honestly, the whole mask thing, I don't even know what to say about that. I think it's so ridiculous. The double standards are insane to me. We've got people are supposed to wear masks to go to the grocery store, to go out in public. But then you've got COVID positive staff in like nearly a dozen states taking care of patients, and they're not wearing N95 masks when they take care of these patients. It's absolutely ludicrous.
Well, and that's just the ones that they're telling us about. Those are the ones that are admittedly doing it. Well, and here's an interesting thing that I've noticed in this since the last time we talked. Places like Walmart, places like Amazon, these places with massive numbers of workers that are around each other all the time and around the public all the time because they're interacting with them. There's no real numbers about who's been sick at Amazon, who's been sick at Walmart. They're all kept real quiet, and it goes along with this whole notion that you just hinted at it, that there's a special class of people that they get to do their thing regardless of the mask mandates. We got Governor Newsom going around having a party in a restaurant somewhere where it was more than 10 people, after he had insisted that everybody has to wear a mask and it can't be more than 10 people. And all this. Caught him in a restaurant having a party with a bunch of people. Mayor in some place, or governor in one of the other states, talking about all of you stay home for Thanksgiving, jumps on a plane, flies somewhere else for Thanksgiving. It's so ridiculous that this happens. And that's what I mean about the idea that the normal people aren't saying, wait a minute, you're kidding, right? You guys can walk around, do whatever you want, go wherever you want, break all the rules that you set for the rest of us, and we're out here having to follow it. And I have you seen enforcement? Is that something that you've noticed?
Some. We went through some periods of heightened enforcement here. We kind of live in a little mountain town. where we've got, the congresswoman who says we're going to do what we're going to do. We're not doing any mandatory vaccines, and so we're a little pocket of resistance here. We have had some heightened mask resistance. Like at the grocery store, you can tell people go in, and if one person's not wearing a mask, then you see maybe others inch it down underneath their nose, and maybe eventually it gets down under the chin. So people are empowered by each other, It's just an issue of actually standing up and saying, this is ridiculous. I'm not sick. Asymptomatic, it's I don't know. It frustrates me very much the way that they're using the language to perpetuate the fear. You may be asymptomatic, but you're still a carrier. You're still a threat to everyone. It's just ridiculous.
Yeah, it really is, and it leaves you kind of speechless. I know what you mean. Because you see that it's entirely manipulated, and they're at best they're guessing, and they're just
absolutely guessing. They are it seems like everything's been a guess, and whatever they come out with this week for information, next week it's going to be inconsistent, and maybe they're going to backtrack. It's kind of like that whole, the World Health Organization was a huge proponent for staying home. They even had that whole, what was that? Some global citizen thing with Lady Gaga, and they did all this. We're all gonna stay home, and now they're maybe backtracking a little bit and saying, hey, why are you politicians making everyone stay home? This isn't healthy. It's constant gaslighting. You can't get it right. Whatever they're saying this week, it'll be different next week.
And it's been like that from the beginning. We had the question of the masks. We had Fossey coming out saying masks won't work. That was his initial response, and then 2 minutes later, masks are just fine. And then 2 minutes after that, it's they're actually to make you feel better. They don't actually do anything. It's just to make you feel better when you're out on the street. It's just it's a good sense of feeling that you get when you see other people trying to protect each other with the masks. And so there's this, and then I've shared the link. It was off the CDC website. It's this study. It's a study like you would actually conduct a study. You actually take all of this information from all of these different sources, and you look at it. You go through it with a fine-tooth comb, and you find why this works and why this doesn't. And they looked at 74 years of people using the surgical masks inside a hospital environment or a clean environment. And even in those environments, just wearing a mask does not stop the spread of things like the flu. So why would it stop the spread of this is, of course, the point. And this is a conversation. This is a paper that was released earlier this year. It just happened to come out. It didn't have anything to do with COVID. It wasn't somebody trying to debunk the COVID mask thing. It just happened to come out this year that somebody had gone through and looked at 74 years of using masks, and what they determined is that if you're not washing your hands constantly, it doesn't matter if you wear a mask or not, and that was the bottom line. And then I went back to find that article, and it was gone. And then I went back to find it again, and it was there again. And so it's just,
isn't it funny how that happens? It's getting really hard to even cite sources because they just disappear. They just disappear, especially if they're dissenting.
Yeah, and that's part of the one of the other things that I thought we would talk about a little bit is this idea of people being shut down. You've noticed it. I've noticed it. I think you've been a victim of it to some extent. I've not. I've been lucky. I've had my reach cut considerably, but it's jumped right back up. It's growing again. It's just them messing around with their technology. I don't think anybody's purposely trying to block me, but there are people out there activists, anarchists, people who are fighting for freedom in one way or another, mostly with words and ideas, that are being shut up. They're being shut down, turned off, pages taken away. Never was another guest that we've had on the show, Karen Keener. I think you know Karen.
I do know Karen.
Yeah, she's one that had her account, her main social media account taken away, and she's never done anything to anybody. It's just it seems to be kind of random and weird, and again, it's just scary because you don't know where it's coming from and you don't know where it's going, and I don't think any of the people that are in charge supposedly know either.
That's the hard part, isn't it? I have not yet determined if I think that this is malevolence or incompetence or a combination of both. The prescription in the end is going to be the same. It's all about how do we divest, how do we remove their control so that they can't use coercion. But man. There are just no answers whatsoever.
There really aren't, are there?
And it just gets weirder. I mean, we've had murder hornets this year, and now we've got zombie mink. It's like, where are we going with this,
Well, I mean, how much of it is incompetence? How much of it is a concerted effort to control? These are the questions, but unfortunately, they become questions that kind of distract from the reality of what's going on. I like to say that these things are they're meta events. They're things that they're nothing you can do anything about. It's what happens afterward that we have to be watching on, and that's why this mask thing concerns me so much. It tells me that nobody else is paying attention. They're not paying attention. There's like 1 in 50 or 100 people that even has a clue, and they still don't know what's going on because we're paying attention and we have no idea.
That's right. And the mask thing, it's got its issues. I've got coworkers who have yeast outbreaks on their face and in their mouth and their throat. We've all got sinus infections. We've had them all year. It's pretty silly time.
Yeah, I mean, you're working in the industry. You're seeing what's going on, but you're in kind of a smaller place. So one of the problems I've had trying to explain to people is what they might be seeing in their own backyard versus what's going on in more populous places.
Yeah, that has definitely been an issue. What we see in our small town is vastly different than they're seeing in large urban centers. But even there, I think there's been a lot of argument about what they're actually seeing and what they're really dealing with. You look at the influenza numbers from last year to this year. I don't know about in bigger cities, but, I talked to my lab techs, and we're not testing for influenza. Flu season started at the end of September. We're not even testing for it. So I'm not sure how we can separate that out from some of the other respiratory ailments that make people really sick and maybe end them up in the ICU on a ventilator,
Yeah, and that's been one of the big problems all along in this thing is this idea. Well, the CDC is not even keeping numbers this year. It says right on their website, we're not even keeping flu numbers this year. I mean, that's just silly. Hey, we got to go into a break. We'll come right back here. We'll talk some more with Rachel Nielsen. We're talking about COVID-19 and the social media shutdown and 2020 rage and just all of it. Wow. The masks. The craziness. We'll be right back on Toward Anarchy. Just go to towardanarchy.com. That's the easiest way to follow on. You're looking for November 29th if you want to see who it is and what it is we're talking about. Rachel Nielsen is my guest. We're just catching up. She's a nurse. She's been working on the front lines with COVID, battling that. But she's also an activist and an anarchist, so she's seeing things with a similar perspective to my own, but with that inside knowledge too. And it's unfortunate because because we show up here and we want to talk about these things, and the first thing we realize is, well, there isn't much really that's changed. That's really bad. We're here all these months later, and we know no more than we knew before when it comes to how real this thing is, how much of an impact it's really going to have when it's all said and done, if it's ever going to end. It doesn't seem like it's going to. Where are we headed with this thing? Next year's 2021. I'm pretty sure that's the year that Mad Max, the Road Warrior, occurs. So, where are we headed with this thing? Is the world really going to fall apart? Is it all going to be over a overhyped virus that 99% of people seem to be able to recover from? I guess those are the questions, and I don't know if we'll answer them or not, but we're going to talk about them as much as we can. How you been? How are things in life going? We got just this short segment here, and so I don't want to start talking about any more of this confusing stuff. I want to talk about you and how you're doing and how your life is going.
Pretty good. We're just plugging along in Colorado. We don't have huge disruptions in our supply chain yet. I'm still at work. I still have a job as of right now. Now that may change depending on the vaccine that they're coming out with. My employer at this time says that they are not going to make it mandatory. But if that changes at some point, then I'm not a nurse anymore. And that's a weird thing because that's what I've done for the last 15 years,
Right.
I think there are a lot of people in that position where they're trying to figure out, well, gosh, what's next if I don't keep doing this?
Yeah, my wife is in that position too. She's a public educator, and so that's one of the places where we'll see a forced vaccination push on teachers in the public education system. You guys will be first, though, I suppose. Isn't that the order?
That's what they say. Yeah, that's what they say. And Colorado apparently is going to be a big testing ground. It's one of the first states that's gonna be offered the vaccine.
Yeah, I'm not surprised about that. It is the capital of the New World Order,
It surely is. It surely is. Speaking of which, our governor is positive now, and so is his husband. Yeah. Asymptomatic, of course, so they'll be fine. Isn't it funny how many people are asymptomatic? When you look at the numbers of people who are asymptomatic, then you wonder how many are really actually symptomatic. Mm-hmm. How many people get the severe form of this disease? I think the number's very low.
Very low. Well, and again, this all goes back to this is argument that anybody who pays attention, anybody who understands how this stuff works, even if you just have a basic understanding of statistics and numbers, you get the idea that the more you test, the more people are going to show up positive. If you threw a panic every year, like we have this year, every time the flu comes around, you would find out that almost everybody probably gets the flu. Almost everybody is probably asymptomatic. They have a headache one day or something like that, and that's the extent of their body's reaction to the flu.
And we need our bodies to make those reactions because we've got immune systems and we want them to function. That's what they do. They do their job,
and they do it well if we're feeding ourselves. And I don't know if I want to do this. I've been remiss to talk about this because I don't know who to talk to about it specifically, but that's the germ theory thing. Have you paid any attention to that, or do you?
A little over the years. I have not gotten very heavy into it with the COVID just because there's so much misinformation out there that I don't want to put any of it in my head.
Right, that's it exactly, and that's exactly what I've thought about it. I've just tried. People have talked about it and they brought it up, and I'm like, the germ theory thing doesn't really matter because what we're talking about is it's a meta thing. It doesn't really matter how it got there. It's the body's response to it that we need to worry about. It's what we need to do with ourselves to strengthen our body so the body can fight it off, whatever it is. We got to roll into the top of the hour, and we will come right back. We're talking to Rachel Nielsen right here on Toward Anarchy.
This is RBN, the Republic Broadcasting Network.
We are living in an artificially induced state of consciousness that resembles sleep. The poor and the underclass are growing. Racial justice and human rights are non-existent. We have been lulled into a trance. They have made us indifferent to ourselves, to others. We are focused only on our own gain. That is their primary method of survival. Keep us asleep, keep us selfish, keep us sedated.
You're listening to Toward Anarchy on the Republic Broadcasting Network. Here's your host, Michael Storm.
Up into hour number 2, it is Toward Anarchy. Go to towardanarchy.com. Look for November 29th. You'll see my guest is Rachel Nielsen. You also see I shared some links up there, as always. And if you can, support the show. Click on that shop and support button. Buy a T-shirt, something like that. Buy one of the things that is in my eBay store. If you're into toys, there'll be lots of those. But like I said, tonight, I have some silver. I have a number of pieces of silver, some U.S. coinage, older than 1964 kind of stuff that I'll add up there because I know you guys like some silver. I have some copper bars. I'm gonna throw those up there as well. And man, I tell you what, this is a weird conversation because just like Rachel pointed out right at the beginning of the show, right when we first started talking, is that we're kind of in the same place, and so we're all just sort of sitting here batting back and forth these ideas about what's going on. And I was trying to show you, Rachel, during the break, if you could see it on the camera or not, is I had remembered to write down the thing about the UK Freedom Pass, and that I just jotted a note, says UK Freedom Pass. That's it, because that's what they're doing. They're making it so. Well, here's the thing that they're talking about now here. I noticed somebody, I think it was one of the guys, maybe one of the senators in Colorado, so you may have heard it too. A former senator as well that was backing it, former congressman, a couple other people talking about no stimulus check if you don't get a vaccine. They bribe you with the vaccine. You can have a stimulus check. Here's your $1,500 or whatever it is. By the way, let's stick these nanoparticles and other things into your arm so we can track you and trace you and all that. Have you heard about that? The new tattoo vaccine and all the information that it contains. Yeah.
I have. I find it absolutely just a dystopian nightmare. I think it's anybody who isn't questioning this is being really naive, and that's fine. You know, I've got coworkers who say that they would absolutely take any vaccine that was recommended by the CDC. I am not that trusting. I am not. Most of the people that I surround myself with are not that trusting. I think it shocks me every day how forward they're being about the things that they're doing right now, and we're all just eating it up. Or I guess we're not all eating it up, but there's a huge number of people who really are.
Yeah, I wonder. I guess it brings to mind that question of of course, where do we go from here? Where does it all end up? But that's up to the individuals as far as I'm concerned. That's up to us. We'll figure our own thing out as we go along. But until then, we have this rage that's going on. We have these people that are so angry and so mad from just the social media out into the real life. It's just there seems to be a level of anger, a level of frustration that we've not seen before here, and that in and of itself is scary because that's just one more reason in a long list of things that give authoritarians a reason to mess with stuff, a reason to throw people in jail and fine people and make mandates, and so the whole thing is just scary.
It really is. You know, I think people just everybody's got an empty cup right now. They're just not feeling terribly resilient because it's been so insane. And then it just becomes an issue of how do you how do you remove your consent from that system? You know, how do you avoid that coercion? And that's the fun part, because that's what we focus on is trying to build a better way, get out of that system. I have a few of those if you want to hear them.
Absolutely, you bet.
All right. So I really want to encourage people to investigate like black and gray markets. You know, look for those alternative sources for getting their medications. Research the Open Insulin Project. That's an interesting one for diabetics. There are people who are getting stem cell infusions. I don't know if that has any indication for COVID, but it is a big thing for health. CRISPR gene editing. We've got the farm and fleet stores and fish stores for antibiotics, antifungals, concierge medicine. You know, recently my doctor wanted to see me in the office to get a refill for estrogen. I'm menopausal, so that's not something that I need repeat labs or appointments for. I just need estrogen because I hate hot flashes. They're miserable. Well, they wouldn't do it unless I came into the office, and I didn't want to come into the office because they wanted me to do all of my mandatory blood tests and all the stuff. So I use Doctor on Demand. I have health insurance, so it cost me $10, and it took 10 minutes of my time. And that's something that you know, other people can do too. They can use like a Doctor on Demand or a concierge medicine service to get prescription refills so that they don't have to jump through the hoops. And that might be an issue if your doctor won't see you unless you have gotten vaccinated, you know, is that concierge medicine and the Doctor on Demand service. There may be other services. That's just the one that I used. Man, I really want to encourage people to prepare for that supply chain disruption. We've seen it for all kinds of things. We've seen it for toilet paper. We've most certainly seen it for medications. We've had medication shortages, critical medication shortages for the last like 3 or 4 years in hospitals where they're not manufacturing all of the medications all the time. You know, they start making other things. And people who have chronic health conditions like hypertension, stuff like that, where they're taking the same drug all the time, I really encourage them to have some back stock in case there is a supply disruption. You know, and it may be as easy as like getting. Some people say you take a 25 milligram metoprolol pill. If you get 100 milligram metoprolol pills, you can cut those into 4, and now you've got 4 times the prescription that you did have. I want people to think about those things. What's going to happen if there's a supply disruption in a medication that really is, you need to live, you know?
Yeah, I think that's a really good point, because I know that there's we have a metapharma industry. It's spread out all across the nation and around the world, and they have people hooked on all sorts of things, whether they need them or not. They absolutely should have them and be thinking about these things in the case of shortages. I don't know if you've noticed it or not, but we've had short supply of meat. Particularly pork is one. Is much harder to find since this all occurred. Right away, back months ago, there was a lot of shortages, and I've been waiting, watching for some kind of tipping point, and I don't know if you can see that. I don't know if you'll see it coming. There's not going to be much warning about this. I think this is probably all you're going to get is conversations like this and somebody saying, hey, you know, it might be a good idea if you have a little extra set aside just in case. I think that's
it
the best
seems
we
like
got.
it seems like it can happen just overnight. It can be so fast and catch people off guard, but it shouldn't be catching people off guard at this point. It's something that they should be thinking about.
Yeah. There's so many things to consider when you're talking about preparing for something long term, a potential like this, and the reality is that you can never prepare too much. I don't think you can ever prepare too much. The only thing that you can do is end up so overwhelmed that you can't manage your preparedness.
Yeah, I'm sure there's a line, somewhere between being perfectly prepared and being absolutely obsessive and letting it drive you crazy. I'm sure we don't we don't necessarily want to foray over into that, but I think a lot of people have like family members that they're concerned about, like. Right now, we've got a system where you can still get emergency care, but that kind of depends too. We've got old folks in old folks' homes that are having massive COVID outbreaks, and they are not getting emergency care. So that's something to think about. Is how do you provide your own emergency care? Anticipate what your family might need.
Yeah, and it's a roll of the dice because you don't really know. I mean, if you're lucky or unlucky and you have pre-existing conditions and you're already dealing with them, you know about those things. It's all the unknown that you just, I don't know, are we going to be out of food? Will we be out of a certain medicine? And the answer to all those questions is yes. Eventually, yes, absolutely.
Eventually.
How much do we get in place of it? Where do we keep it? Are you prepared to move away from? There's so many questions when it comes to preparedness. Everybody just has to. They really have to take it upon themselves to analyze their situation. Look at the people around them. Can they help? Are they a hindrance? What do you need for them? How much food? How much water? All of these things, they're all going to be personal, and everybody's going to have to take their own steps to do something about preparing for themselves, and most people won't. And so what's going to happen is we're going to have these things are predicted. These things happen. You have mass exodus from cities. You're already seeing it. It's happened slowly now over the last few months. People have left New York and California en masse. They've just packed up their stuff and left. They've gotten out there. It's smart. It's a good thing. Get away from big city centers where there are a lot of people and where services would be overwhelmed. Just all these different things that each individual has to think about given their own personal situation. It's always been hard. Being prepared, this is just making it even a little bit harder. It's just one more thing.
It is definitely. And, isn't it funny when you think about, like, the movies and the entertainment that they've been putting out for the last 10 years, it's kind of been preparing us for this. It's been all of these viral outbreak movies and shows, and we've got the prepper shows on television. Just everybody's had an opportunity to think about this and try and figure out, what do I need to do in order to try and be more resilient and be more adaptable? How would I get through some things? And I think most people have asked themselves that, and now it's time to do it. Time to do all those things.
It's time to do those things, and it's time. I think what's going to happen with a lot of people, and this is even people that are prepared and the people who understand this, is that they get frozen. I know that's the way a lot of people feel right now. They just don't know what way to turn. They don't know where to go. They don't know what's coming down the pipe. And my suggestion is to all those people, don't worry about it. Take care of yourself. Take care of your things, concentrate on your day-to-day, and look at your future, but don't try to guess what's coming down the pipeline. Don't try to figure out what they're going to do next. Spend a bunch of time sitting around pontificating about how bad it's going to get. Make it good for yourself.
Yeah. I mean, we can't possibly anticipate all the different directions this would go, because who could have anticipated the COVID mink? That I don't think that was on anybody's radar. It's I think it's just an issue of having some tools in your belt, having some skills, having quality people around you who are smart and know how to take care of themselves, so that you can take care of yourself while they take care of themselves. You know, networking, mutual aid networks are becoming a big thing. And I think that's really fantastic, because it brings people together to problem solve, and that makes them all more resilient.
Yeah, everybody learning from each other, and it's everything. It's one of the positives that we talked about when all this started. One of the few positives that's come about it chasing us back into our homes, forcing us to reinvest in the people around us, and to get back into our own lives, and to just really kind of separate ourselves a little bit from the bigger picture, and concentrate on ourselves, bring ourselves closer together in family and friends, and I've seen some of it, and I've seen some of it go in the other direction, but I see a lot of fear. I just see a lot of fear from the people on the street. I see it in their eyes. They don't know what's going on, and then I see it from the it's all in the press. Every headline is what scary symptom or remainder, after you've had COVID is going to be left over. You're going to be tasting blue for the rest of your life or something. It's just all of these. It's just fear after fear after fear, and fear causes a number of responses in people, and the biggest one is that people freeze. They don't know what to do.
Yeah. It also affects our immune system to live in that state of panic, and I think we're seeing a lot of that right now. Boy, the fear is just it's crazy, isn't it? I go to the grocery store, and if somebody comes around the corner and they run into me and I'm not wearing a mask, they jump back. It's this huge melodramatic thing. And it doesn't look contrived. It really honestly looks like terror, like they're afraid that I'm going to infect them. And that I feel a lot of pity for them, because that must be a terrible way to live.
Oh yeah, just in constant fear for some. I mean, I get it. I understand, but you can alleviate a lot of fear by just trying to go out and learn a little bit out yourself. Just try to weed through the headlines, and find some good information, and try to understand what's going on around. It's interesting, because initially that fear response and that anger response were so prevalent, and then it went away for a little while, and now that they've ratcheted up the fear again, now that they've said, oh, we got more lockdowns and all this, it's come back again. And I see the fear and the anger in people's eyes when they see somebody who's not wearing a mask. And it wasn't for a while. It wasn't like that. It was like I was looking at them, and they were jealous. Like, oh,
Yeah.
you're brave enough to not wear the mask. I wish I was that brave.
Yeah, and sometimes they do get that brave. They do feel empowered to stop, but for the most part, I think sometimes I wonder if they're gonna attack each other out there, because there are some stories of violence, where people have been unmasked, and masked people have perpetuated violence against them. And I wonder if we'll see more of that, because as the fear ramps up, people feel vindicated using violence to try and get the result that they're looking for.
No, yeah, absolutely. People will turn right to that. It's kind of natural. I mean, because you have these responses. I talk about the barking dog arguments, where you get in an argument with somebody and they just keep blah, 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 right at you, and you're never going to change their point of view. Well, that's a huge, that you're sort of hollering at people, calling them names, barking at them. That's the human equivalent of barking at someone. It's stay away from me. I don't like you. I'm afraid of you, or you should be afraid of me. Go away, back off. And it's an interesting thing with the masks. It actually interferes with that ability to see a person and see their face and to see the expression on them, to be able to tell if they're afraid of you or if they're angry at you or if they're ambivalent toward you. And I find myself very mad walking around. I won't even do it anymore. Most of the time I'm ordering my food now online and just picking it up because I don't want to be in the store. I don't want to be around these people because it upsets me. It makes me mad to see them there. And I walk around muttering under my breath, "You masked people and you stupid cowards," and it just, it's not good for me.
No, both the fear and the anger, that stuff's all contagious, We pass that stuff on.
Yes. Oh God, I'm gonna get in trouble. It's the Eddie Murphy joke about being angry and about taking that anger home and coming home and kicking the dog, or beating the wife or something like that. And it's just, we perpetuate that. And now with it being so prevalent, you can't even walk into the local gas station without the questioning. There's a line. There's even a line now because of the social distancing. There's just all of these weird changes in people, and they're just walking around just sort of kind of numb to it until they see that person without the mask, and then all of a sudden they get that look in their eye.
Yeah, they do.
Get a little wild, and I don't know where it goes. Do you see an end to this? Is it going to end, or is this the new normal?
Well, it's definitely not normal, but I'm not sure that I see an end, as long as it works for them as a control mechanism, I'm not sure why they would do anything different. Yeah. And that's it. That's what they do. They bring down these commands from on high, whether they make sense or not. You have to comply. They've been using that word compliance for a very long time, and this is just more of that,
Well, it's funny, sad, not funny, haha. That is sort of more than a year ago. I guess in probably September of last year, I made that argument because we've had this vaccine conversation going on for a long time. And certainly in the last couple of years, it's become a bigger deal because of the measles outbreaks in a couple of places. We had the shutdown in New York where they were, it became about keeping mosques and people from gathering. And we're going through this again now. But we were going through this a couple of years ago. And I came out and I said that this is the breaking point for people, that this vaccine thing is the thing that's going to push people over the edge on this, because I don't think that government has spent the years that it would have needed to build up its strength in this department, and that's the control over people's health. It's been this back and forth thing. Oh, government can't do it. Government can do it. Government can't do it. Well, I think government can do it now, and I think they're proving that they will do it. And so the next step is those forced vaccinations. This idea that you're not going to get paid, you're not going to be able to have a job, you won't be able to go places if you don't comply.
Yeah, that's definitely what we're looking at. Those passports are an interesting thing, how I wonder once they have mass availability of the vaccine, how many people are really going to take it? Mm-hmm. And I don't think we have any idea how much resistance there's going to be. I would bet that probably a quarter of my coworkers state that they're going to refuse it for various reasons, whether it is because it hasn't gone through appropriate testing and trials, or based on the ingredients in it, the RNA issue. There are a lot of reasons, but I think we won't know until it's actually available, because some people will cave that said that they did not want to get it. And some people that said that they can't wait for it are actually going to have second thoughts. I've heard that from a lot of people. They wanna do the watchful waiting and see how many people get sick from it before they actually take it themselves.
Yeah, well, it's easy for people like ourselves who've been paying attention to the issue for a long time and we've been watching it. I don't have any faith in vaccines, so I'm not going to have any faith in this vaccine for sure. I've never seen, and people will call me crazy when I say this, but whatever, it won't be the first or last time. I've not seen any shred of evidence to suggest that vaccines actually work. Every single vaccine is introduced well into, this one being different, but this one being a lie, well into any understanding of disease. You have a bell curve of all things, the least of our understanding at the top and the greater understanding at the bottom somewhere. And we're well on our way to the bottom before vaccines ever come along. And so to me, that shows that at best there might be some indication that a couple of people get something out of it, but that in the general sense, there's all these diseases, these things that have never been cured for vaccine, and they hold that same bell curve, that same exact curve, and it comes with our understanding of the transmission and how to keep yourself from getting it, but and how to treat it and things like that too. So there's all these other factors that are that people should be considering when they look at the efficacy of a vaccine. And now we're talking about the vaccine. I just said it just a little bit ago. 2 days took them to make it, when before no modern vaccine's been made in less than 7 years. And
what's your recourse? If it makes you sick, what's your recourse? What do? Nothing.
Die.
Yeah.
If you're lucky, you don't die.
Yeah. Overseas, there's a polio outbreak from the oral vaccine. Mm-hmm. We've got in South Korea, there was a big rash of people who got sick after the influenza vaccine just this last couple of weeks, and they're still pushing for as near 100% vaccination as they can get. I just think people get sick from these things. We're not allowed to talk about it, and there's nowhere to go to get care afterwards because nobody believes you. Got all these parents who tell you that overnight their children were changed after getting vaccinations, but they're called liars.
Yeah, and yet we have tens of thousands of people every single year who have adverse reactions to the things, millions of dollars paid out every single year. It just, to me, it just shows that people aren't paying attention, that they're just having to let somebody else decide their health for them, to make all of their decisions across the board. Geez, did we do it already? Already done? Oh, my gosh. Thank you so much for hanging out with me. I can't believe we hit an hour of this already.
Man, it goes so fast.
Doesn't it, though? Well,
it was great to talk to you again, Michael.
Yeah, it's great talking to you, and I'll have you back again real soon. Thank you so much, Rachel.
Hopefully we'll know more then.
I hope so. Take care.
All right. Bye, Michael.
Bye-bye.
Visit our website by going to republicbroadcasting.org.
All right, welcome back to the show. Go to towardanarchy.com if you want to follow along. As always, make sure to like, subscribe, follow, share, do all those things regardless of what platform you're on. I've tried to make it as easy for you as I can on my end to do those things, but and all those other guys do too. If you just look around wherever you find the show, there's a way to share it. There's a way to give it a like. There's something to follow. Do that. Spread the word around because the show is getting huge. Relative to 7-8 billion people on the planet. Statistically, there's somebody listening to the show all the time now. And it's a really fantastic thing to think about. And I've reached some sort of Rubicon, not that there's necessarily a line that I've crossed that I can't go back, as it were, but we definitely passed this point where it's constant now. There's constant feedback. It's the weirdest thing. It just happened over the last few weeks. Whatever this magic number, whatever this magic point is, to where I'm constantly engaged now. I was not constantly engaged before. I was regularly engaged. Now I am constantly engaged. It's everywhere, and it's fantastic. It's wonderful. It's a little bit scary because then you have to make sure that what you're doing and what you're saying is valid and is as accurate as it can be when you do it. And so, of course, right as it's all beginning to happen, I end up doing exactly one of the things that I try to get people to avoid doing, and that's making a poor emotional argument for something that is a real thing. And so, boy, wow, way to kick yourself, just right out of the gate in that sense. But I have this number of different things to talk about. One of the things that I wanted to do, we've been on this for a few weeks, and we'll come back to the conversation. In fact, coming up here, I'm not exactly sure when. We only just discussed this last night. I will be participating in a debate, and we'll debate the question of agorism, but not really. And this is. You guys have to lay off. You got to let up. I am not against agorism. That's the thing that for some reason people seem to have missed in all of this conversation, along with the part that I'm not wrong. And that's why I said when I had an apology to make that it didn't have anything to do with the agorists. I want to make peace with the agorists in just that general sense of that I really don't have any problem with agorism. Just like Bitcoin, I don't have a problem with Bitcoin. The only thing I've ever done is look at it and say the truth about it. I look at how it functions, how it's used, the way it works within the marketplace, within the system, whatever that system may be. If it's something like Bitcoin, all I've ever done is look at it and try to point out where it fits within the market versus what people say it does versus what it actually does. And that's the same with the agorism thing. And with the agorism, if you go to towardanarchy.com, you can find this. I put it in the articles. I'm rebuilding the articles system, the articles page, because HBY died. And so I have all my articles and I need to put them back up there. But you'll notice the ones that are up there are the Bitcoin one and the agorist article. And in both of those cases, all I did was look at what other people are saying. In the case of agorism, all I wanted to do was try to reconcile why one person would come to me and say that they are an anarcho-capitalist and agorist, or that they don't have any problems with money and currency and things like that. And then the next agorist I talk to is anti-capitalist, anti-money, does not understand how these things work within the market. So when I challenge either one of those people, either one of those archetypes, because they're not individual people, this thing that's been happening for years. Look, agorism is 4 years old, and most people heard about it last week. There's a reason why. Because it's just words. It's just another group of people looking to make themselves feel better, telling themselves that they're doing something different. And that's not to say that there's anything wrong with it. But this is the language used. They use the term counter-economics. And so I just wanted to say to people that there's no such thing as counter-economics. Because if I ask them, either one of those people, their answer is black and gray markets. That's not counter-economics. That's just not shopping in the major market. That's all. That's just buying your things in the black market. And without the state, there's no such thing as a black market. They're just markets. It's just another market. Well, I use alternative currency. Fantastic. It's still currency. It's still pegged to the dollar, and it's still economic activity. It's not counter-economics. And so my claim is that the term counter-economics is basically just a code word, a phrase for people who are anti-capitalist. And so it confused me. I'm looking at the words of Conklin. This is a guy who 40 years ago created, it's more than 40 years ago now, but it's almost 50, created this agorism, created this idea. But there's nothing original in agorism. Agorism actually exists everywhere else. There's nothing original about what's in agorism. It's just a way to label yourself and to make yourself separate from everybody else, believing that you're doing things differently, but you're not. Now, the difference, okay, of course you can participate in economic activity that doesn't support the state, but that's still economic activity. It's not counter-economics. It's counter-state. Okay, and so here's what happens. I make this argument. Agorists jump all over me because they're telling me that I'm wrong, that I'm misunderstanding, except that I'm not. It's not me who's misunderstanding. And so I do this article, and then I want to add an image to it later at some point. I am posting it up on the website, and I just want there to be an image with it. And if you're there at towardanarchy.com, you look under the articles, you'll see, Dear Agorist, there's no such thing as counter-economics. And it's got the A3 symbol, and it's agorism, action, and anarchy, or something along those lines. Some mix of those three words, or variations of activism, activity, action, something like that. It's A3. It's an agorist symbol, and I just wanted to include it in the article. And when I was looking for that article for that particular image, or some agorist image that would associate with the article, I came across this headline. It was glaring. I wasn't even looking for it. Agorism is not anarcho-capitalism, by Derek Brose, September 13th, 2016. I typed in agorism, and that's one of the first things that pops up. So what I'm going to say to you is, I am not against agorism. What I am against is people using words and phrases that don't mean anything, word salad, redefining words that already have definition, trying to call counter-economics a real thing, but still actually doing everything that you do in any other economic situation. That's the point of economics. It's a natural thing that you can't avoid it. It's how people trade, and it's all about the manipulations and things that go on to that go into it. Those are individual or group manipulations or machinations, just their idea that they want to reflect in the ideas that they're expressing in agorism or in anarcho-capitalism, and it doesn't play with me. I will not play the word game. I'm not going to try to make myself feel special or different, locking myself off into this little group of people over here, when this guy, this is what brought this up again. I was already going to talk about it, but I just wanted to be so clear about this, that I don't have a problem with agorism. It's what I have a problem with on the show all the time, and that's the misuse of words and language, and then trying to make people think that they're doing something that they're not by changing the words or obfuscating the meaning of words. Agorism is not anarcho-capitalism. If one of the greatest proponents of agorism today says that it's an anti-capitalist notion, then it's an anti-capitalist notion. And I am completely vindicated in saying so, and he does, okay? Capitalism, this is Conklin's idea, capitalism means the ideology of capital or capitalists, and that ideology, according to Conklin and according to the likes of Derek Brose, is that all capitalists use their wealth, their capital, to influence the state, to use coercion against other people, to restrict the market, to basically say that all capitalists are just statists. and that they all use the system of the state to force other people to buy their products or whatever. And it's patently false. It's absolutely not provable. There are millions of capitalists running around that have never used the force of government against somebody else. So it's a lie. It's a lie. It's a complete mischaracterization of what capitalism is. Even the ism isn't, okay? Ism is not defined as an ideology. And all the definitions that I look up for the word ism, for the affix, prefix, for the, the ISM in ism, every single one of those that I pull up, not one of them uses the word ideology. In fact, they almost always use the word practice. Not just an ideology, but it's a practice. So it goes along with my argument that capitalism is the literal practice of being the head, capital, kaput, the root word, head, decision maker of your own personal economic decisions. Your money, your wealth, your decisions. You get to be the first, the primary, the capital, the head decision maker. And so this is a quote from the article from Derek Brose. Before Marx came along, the pure free marketeer Thomas Hodgkins had already used the term capitalism as a pejorative. Capitalists were trying to use coercion, the state, to restrict the market. Capitalism then does not describe a free market, but a form of statism like communism. Free enterprise can only exist in a free market. That's total word salad. It's just a jumbling of a bunch of words together to make it sound like capitalism is bad. But if you actually read what that says, it says that capitalists are using using their capital to force the state to make other people see things their way, buy their product, limit other availability of other products or other places in the market that you can go and shop and find things maybe at a better price or whatever. But it's not true. It's just not true. I've never done it. I'm a capitalist. And so that claim is patently false. And the reality is that it's not capitalism that it's a bad thing. It's not a bad thing for you and I to be the person who makes our own economic decisions, to be the first person in line to say, this is my money, this is my wealth, this is my health, to make these decisions before anybody else, before taxes are stolen out of your paycheck, before any of it. And the truth is that anyone can use the tools that are capital to be influenced, to influence the power of the state, to use coercion, to force people to do whatever it is somebody wants them to do. It's not capitalism. It's not capital. It's not my wealth and me being the decision maker of my wealth that causes the state to coerce me to, right now is a good example where a lot of the small businesses are restricted in the things that they can do, where the big businesses seem to have carte blanche to do what they want to do. That's not a fault of capitalism. That's the state doing that. Just because capital bought the state doesn't mean that capital is bad. It means that the person who had that capital used it to buy the state. They use that tool in a negative way. Just like guns, just like forks and knives and spoons that you eat with, just like cars. These things are tools. They don't exist. They cannot function without somebody behind them using them for the means, for the ends that they want. So it's a dishonest conversation. It's word salad. I read through the basics. They told me that I didn't understand Conklin. I understand it perfectly. It's an anti-capitalist movement, and there's a whole bunch of capitalists wrapped up in it that don't know it's an anti-capitalist movement. They say it themselves. I don't know how to put it any more clearly than that. You cannot tell me that I'm wrong, that I misunderstand agorism when it's right there in writing, when it has been from day one. That's my only conversation to have about the agorism. I don't have a problem with free markets. I don't have a problem with alternative currencies, including Bitcoin. But I will not sit here and let you tell me that you're special, that you're doing something different, that what you are doing is better than what the rest of us are doing when it's not. You're being the head decision maker of your own personal economic decisions. That is capitalism. There is no free market without you being able to make those decisions for yourself. That's my argument. We're going to have a debate about it. I don't know the terms of it yet or exactly where when it will occur, but as soon as I have that information, I will share it with you, and I will make sure that everybody gets to listen in on that, everybody that wants to hear it. I don't have a problem with agorism. I have a problem with people who use words incorrectly, who in particular use them in such a way as to make it look like they're doing something different, like they're trying to be special when they're not. That bothers me because it's disingenuous at best. All right, we're coming back and we're going to wrap up the show, man. Let me tell you about who's coming up over the next few weeks. We're booked into January at this point. We'll be right back. Okay, if you go to towardanarchy.com, right there on the front page, you will notice, if you just scroll down a little bit, you see this week's show and the conversation I just had with Rachel Nielsen, and then you see last week's show is still up there on the front page. But right under that is the upcoming. Sean Leal's on the show next week. He's an author. His book is Consent is Morality. We'll talk about exactly what that means with him and his adventure in writing that book. Jackie Kerouac is on the show after that. She's created Road to Autonomy magazine and a number of other things. She's an activist that's been doing this for a while. Sherry Voluntary, also just another one of these chicks who loves freedom. She'll be on the show. I'm getting these female voices in here for you. I always wanted to do that because they're out there and they have these amazing voices and they're doing all these things, and you know that where the women go, the men will follow. That's where the family goes. Craig Hargess is going to be a guest on the show here. I'm literally booked out into the middle of January already, so we have guests and guests and guests. There's no just me for a while again. We'll be talking about Christian anarchy with Craig, and that will be another one of these great conversations I've been wanting to have. I talked with my friend, but that was a friend conversation. That was just two buddies talking. It'd be a little different about, Craig and I are not friends in that sense. Jeff, the person I talked with about Christian anarchy before, it was just that he's a Christian and I'm an anarchist, and we were talking about the compatibility of those things. Craig is a Christian anarchist, and we'll talk to him about the compatibility with the ideas of Jesus and the Bible, and we'll see where it goes. I just think it's a great conversation because I know that there are a lot of people out there of faith that don't know. A word like anarchy is a scary, bad word, and so you stay away from words like that. But there are other people out there that have reached that point and that understanding in their life, and I think they can much better explain the compatibility between the ideas than I could, for sure. No question about it. So that's just a taste of what we have coming up over the next few weeks. Spoiler: if you haven't watched the recent episode of The Mandalorian, they finally have a name for the foundling. His name is Grogu. It's a terrible, terrible name, Grogu. But the cute little green guy is starting to come into his own. I just had to point that out because it's one of the few things that I'm geeking on right now. And one of the articles that I shared today is in relations view at towardanarchy.com. You look at November 29th, you'll see there's a Vanity Fair article there about Gina Carano. She's Cara Dune on The Mandalorian, and the fan backlash over right-wing political positions. More of this idea that you can get people banned and canned for their political thoughts and the things that they say on the social media. We will be back next week with another great show. My guest will be author Sean Leal, and we'll talk about consent being morality right here on Toward Anarchy. You take care.
You're listening to the Republic Broadcasting Network, because you can handle the truth.